before she went on to maternity leave. So I'll let Jenna introduce herself. Jenna, are you there?
Yeah, so I'm Jenna, and I'm also an orthoptist at Wolverhampton NHS Trust. And then Asad is going to start the presentation for us today.
Yeah, so just in case there's anyone other than orthoptists, because it's for the whole AHP network, I just wanted to just give a little bit of brief introduction on what we do as orthoptists and what we do in our department. So as you may be aware, the orthoptists diagnose and treat a wide range of vision concerns, eye movement defects, and problems with how the eyes work together. We work in a multi-professional team consisting of ophthalmic technicians, optometrists, and ophthalmologists. So it's quite a big team of loads of different professions. Here in the Royal Wolverhampton Trust, we cover and provide services across both South Staffordshire and also Wolverhampton. We provide both care in the hospital, but also in communities such as our special schools and primary school service, vision screening services provided by our school nursing team, but we provide the support and help with that. So just going to start on our journey of sustainability. So because the NHS was starting to, come up with ideas of becoming carbon neutral, at a similar time, the British and Irish Orthoptic Society decided that their Orthoptic Day that we celebrate on the 6th of June every year, that the particular theme for that year, 2022, would be sustainability and greener orthoptists. So we used that as a backdrop to kind of start our journey. So what we did was we came together as a department and we came up with suggestions. I think we all had about 2 or 3 each, and then we collated all that, and we then chose 2 individuals. So myself and Jenna were chosen to lead the sustainability drive, and then we'll talk about some of our initiatives in a second. In our trust, we have a sustainability lead, and that's Janet Smith for our trust. And she plays a pivotal role, really, where we meet with her every month. She gives us guidance, she gives us help and support where we need to. So she's been instrumental in our journey and drive. So some of the main team discussions that we had when we asked for the ideas from everybody, we split it into 4 key areas. So those were reducing our paper waste, increasing our recycling, moving patient leaflets online, and virtual appointments. So these were just the 4 big areas, but within each one, there were certain things that we did. So to start with, virtual appointments. So in 2022, during the COVID pandemic, we, as I'm sure most trusts and healthcare providers, we had to innovate and look at new ways of doing clinics. And one of the things that we decided to do was set up virtual clinics. And it started off for our post-op patients and our stable patients, but then we just expanded that. So in May 2023, as part of this green initiative, green journey, we came up with the idea of setting up virtual appointments for all first appointments for children who are attending our special educational needs service. In this consultation, we go through the case history, we go through if there's any communication issues, so we know what kind of tests to look that we can possibly do with this child when they actually attend for the face-to-face. We talk about any concerns or any adaptations that we need to make for the child when they come into the clinic. And we just have a good discussion with the parents. We found that both the parents and members of staff really have enjoyed doing the clinics, because it when they come for their face-to-face appointment, we don't need to do all the questions, which can take quite a bit of time because these children have got complex needs. We can actually get straight into, you know, getting the child comfortable with the environment and then starting to do some testing. And we already know what the child likes, dislikes. You know, for example, there was a child that likes dinosaurs and doesn't like anything else and wouldn't come into the room unless we had the dinosaurs. Had we not known that, we wouldn't have been ready for it. But because we knew through this telephone consultation, that child eventually came in, settled, did everything. So it was beneficial. So from a green point of view, it's avoided unnecessary appointments. I know we're doing a telephone consultation and then a face-to-face, but what this has led to is we've shortened our face-to-face appointments. So we've slotted in, we're able to slot in an extra patient in just because we've got rid of, you know, 10 minutes off that would have taken for the case history. So it's helped with our waiting lists. But it's also helped with reducing travel emissions. So one of our take-home messages is actually it's not just going to benefit the planet, the environment, the net zero gain, but these initiatives can even help the department become more effective and more streamlined and efficient. So as I mentioned before, it started off from the postdoc clinics, which started in 2020. So in all, we're going to present to you the green impact that these clinics have had. And so we've based it on 270 virtual appointments that we've calculated to the point where this presentation was made. So that equates to 3,687 patient travel miles saved. We haven't reached around the world yet. So basically, Janet Smith, who I mentioned was the Trust Sustainability Lead, she helped us to come up with these calculations, and I've put all the links at the bottom there. It's quite a handy tool, really, and I always feel that if you can just picture it, it makes the impact even stronger and even greater when you can just see what difference you've made. So as I was saying, we haven't reached the world, and I did a quick Google search, and apparently to go around the world, it's something like just under 25,000 miles. So I mean, we've got a long way to go. I think Jenna checked, and we've reached like some bits of Europe, and I don't think we've reached some parts of Africa and things. I think there was an app that you could use, but it was a bit weird. It came up in a different shape, so we didn't put that on the slides. But you know, it just shows we're on our way, but not just there just yet with these virtual clinics. But you know, we're going from strength to strength. We've increased the amount of virtual clinics we're doing, and we're going to be doing even more for other patients. We've 214 hours of patient time saved through avoidance of face-to-face appointments. So we all know parents are busy, especially parents who have got children with special or complex needs. So any time that we can save is a benefit to these children and their parents. As you can imagine, they've got loads of appointments to attend. So you know, it's always important where we can to minimise contact or time that they have to spend outside the house. I know with most trusts we have parking issues, and the Royal Wolverhampton NHS Trust is no different. Through these face-to-face virtual clinics, we've saved 125 car parking spaces, and these are averages because obviously it takes into account that some will be travelling by taxi, some will be coming on bus. It's an average, but it's 125 parking spaces that we've saved. And just the virtual clinics have led to a reduction of 0.6 tons of CO2 emissions, and it would take 0.3 hectares of forest a year to capture that amount of CO2. So we're just trying to kind of highlight here that a small initiative like this has had a really big impact, and it will continue to have an impact. Because like I said, this is just a snapshot of when we were doing the presentation, but since then we've done even more virtual clinics, and we're going to expand even further. So, you know, when we present, if we do present this again, you know, in a few months or in a year's time, hopefully we would have made even more of a green impact on that. So one of the next areas that we worked on was a waste audit, and basically our waste management team, they came to have a look at our department, and they came up with suggestions, and we actually implemented all their suggestions. So again, during COVID, we produced quite a lot of clinical waste, even in orthoptics where we don't really use much, you know, we don't do that much clinical waste producing procedures, but because of the aprons, the masks, the visors, we were producing quite a lot at the time. And so what happened was in each room we had a clinical waste bin, and what we found was happening was people were just opening any bin and just throwing like crisp packets, bananas, lunch, paper, whatever in the clinical waste bin. But since we had the waste management audit done, we worked out that we could remove some of the clinical waste bins, get bigger domestic waste bins, so that would help reduce any cross-contamination. Just to give you an idea, the clinical waste can cost up to £850 per tonne, compared to domestic waste, which costs around £120 per tonne. So as you can imagine, this is a major expense for the trust, especially if people are segregating their waste incorrectly. And I don't blame anybody. It's just easy. You find the nearest bin, you just open it and just throw whatever you got in there without even thinking. But I think when you put those costs, I mean, £850 compared to 120, I think that is quite a big cost saving there potentially. So we did the whole waste audit, and he also included other things such as our shops bins and things like that. But in terms of the green thing, the main thing was reducing this clinical waste and getting more of the domestic waste bins where needed. Obviously, we do still need clinical waste bins, but where it wasn't necessary, we removed them. And then we also, as part of this, we installed a recycling bin. So we were one of the first departments in the trust to trial the recycling bins. And what we were finding with that is we were also getting things put in the bin incorrectly. We see quite a lot of children in our department, and what we were noticing, the children were just putting it in any bin. So we did a competition where we got some of the children to design a recycling poster, so that we could put up in our waiting areas. Just a kid-friendly version. I mean, there was an adult version on there already, but for a child-friendly version. And we have found that that has helped with the incorrect use of that recycling bin. It's not fully helped, and I don't think it would ever, but it has helped quite a bit. In our trust, the recycling bags are individually looked at, and any incorrect waste is removed. So there's always that backup plan, but the poster has definitely helped. And our trust has also allowed staff to use the confidential waste bins for recycling. So like any you know, medication containers, any paperwork from home, old bank state, anything like that, we're encouraged to bring in and use the confidential waste bins, because that adds to the recycling and the energy generation for the trust. So it helps with that too. So those were the virtual clinic and the waste audit initiatives that we did. I'm going to pass over to Jenna now, who's going to talk through some of the other initiatives that we did. So Jenna, over to you.
So our next main point that we're going to be talking about is how we tried to reduce our paper waste. So we had quite a few different ways that we were going to do this. So one of our first ideas was to move all our patient information leaflets to an online version. So we're still in the process of getting this done because it's quite a complex task. We're going to try and get them put onto our trust website, not only in a text format, but we're going to have audio versions and video instruction versions for some of them, just so that it's accessible to everybody that needs to see these leaflets. What we're going to do so that patients can access them is going to have QR codes that patients can scan in every clinical room. So when they come in, we can just advise them which leaflets will be best for them. We are also going to be able to text and email the codes out to people, as well as have them on the appointment letters. Obviously, not everyone will be able to access like the online version, so we will always have to have a couple of paper versions available, but the aim would be to minimise as much as possible for that one. Our next one is that every day we have to do environmental checks in our area, so we need to record that we've cleaned the rooms, we've checked the fire alarms, and we've checked the safety pull alarm for if there was ever an emergency situation. So what we were originally doing was a piece of A4 paper in approximately about 10 rooms that would be changed monthly. So over a year, that adds up to quite a lot of paper that was being used for this simple tick box task. So what we have now done is we've got an Excel document for each room, so we can just simply, we're already logged onto a computer in each room anyway, so it doesn't really add any excess time, and you just log it on there. But that has saved quite a significant amount of paper for something that hasn't really added any extra time to our day-to-day tasks. The next one, we have significantly reduced our post-it note usage. So our department used to be quite heavy users of post-it notes, so we were using them for every little thing. The main thing that we would use them for is that we have clinics where we work alongside the doctors, and for that clinic, what we used to do is for every patient review why they were attending and what tests we need to do. And we would put what tests we need to do onto the post-it note on the front of each set of notes, just so, because it's quite a busy clinic, you can pick the notes up and you know what you've got to do. But instead, now we just open the notes, turn to the page that you're going to be going to anyway, and we've written it on there. So again, just a small change, but it has saved quite a lot of paper for us, which is good. The next thing is like a trust-wide thing, really. So we've all changed now to the use of electronic RTT forms. So we still do have the paper version because we're in like a transition, but hopefully you won't have that for too much longer. But for every set of notes, there was like a yellow piece of paper in each one. We had to tick off the outcome, whereas now we're doing that electronically. So hopefully it won't be too much longer before that paper fully goes for that one, which would be really good. We are currently hopefully in the process of discontinuing our paper diary. So for every working day of the year, we have like an A3 piece of paper with what every person is going to be doing for the day. So we have that at New Cross and at Cannock Hospital. So again, that is quite a lot of paper, and we're aiming to get that onto hopefully a version on the computer, as everyone that works there has access to a computer. It is a bit of a difficult process getting this changed, because obviously it's easy for everyone to just go and have a look at the paper version that's on the desk and everyone can access it, and you can't really change it without it being obvious. So it's a bit of a barrier finding the best system that we can transfer that to online without it being too complicated, but hopefully we can get there soon. We currently have a business case out to try and get some tablets for the stroke ward visits and the SEN school visits. So we visit the stroke ward 3 times a week, and we have the SEN school screening visit. So that's where we go and see the children in the SEN schools and just screen them and assess for any vision problems. So for each of those visits, for the stroke ward, it's potentially a couple of pieces of paper each time you go, and then for the SEN school you have like a list of all the patients and a piece of paper per patient, and then when you come back you've got to transfer that onto paper referral. So it does all add up to quite a significant amount of paper for those visits. So if it could be on a tablet, that again would significantly reduce our paper waste. And then another change that has been a really easy one is just switching from like normal paper to the recycled paper in the printer, which does reduce your carbon emissions by quite a lot. So if you can press next slide, please, Asad. So the impact of reducing this paper waste is equivalent amount of CO2 emissions produced by 3.5 houses' electricity use per year, or nearly 45,000 miles in a gasoline car. So all of those changes haven't really put a lot of effort into change, but they've added up to quite a really significant amount of CO2 emissions saved. So this would be the equivalent of 21 acres of forest in 1 year to produce that amount of CO2. So we're quite proud of that amount of CO2 that we've saved just from those small changes, which is really good. So if you can go to the next slide, please, Asad. So another key aim was to try and reduce our plastic waste. So on our floor, we have a plumbed water fountain. So that does save, instead of the plastic bottle system where you have the big plastic bottle of water on the top. So if you were getting that changed quite frequently, that would be quite a lot of plastic. And I believe every member of staff brings their own water bottle in now, so people aren't bringing their own plastic bottles in to throw away, which is good. Another thing that we did that again has only been a small change in Connect but will have made a big difference is for each, especially children that we test, we need to test with one eye at a time. So if they're wearing glasses or they're just going to pull the occlusion glasses off, we use some special tape to cover over one eye at a time. So for each patient, you're popping that off. If it's an uncooperative child, they're taking it off, pulling it on the floor, you're using potentially multiple pieces of tape. Whereas now we have special patches that are reusable. We have a picture of them on the next slide. So we can clean those in between each patient and they just stick onto the glasses. And we can reuse them, so that's good. So that saved us money, so it saves us £30.48 per year, and it's also saved us 116 miles in a gasoline car. So again, it was only a small change in terms of it hasn't took much extra effort just to remember to use those stick-on ones rather than the tape, but it has made a big difference, and all these little changes add up, which is good. So next slide. And then we're passing over back to Asad for this one.
So yeah, before I get on to the barriers faced, I just wanted to reiterate. So I know some areas of orthoptics or some other departments within the AHP professions, we may feel that actually we're not going to make a big difference or we haven't got much to add. But hopefully, from some of the initiatives that we've just discussed with you, such as even using recycling paper in the printer, it can have a really big impact. And sometimes I think it's always, I mean, the post-it note thing, and when Jenna was saying it, it sounded really silly that we were sticking it to the front of the notes and then, instead of writing it in the notes, but that's how it was done. And because things have always been done that way, we never bothered changing it until something like a sustainability drive came in, and then we looked at all our processes and procedures, and then we came up with something so it's probably sounds silly. When Jenna was saying it, I did think, oh, that sounds a bit silly putting it on the front, but it is what we did, and we were getting through so many post-it notes, and it all adds up. So another one of our take-home messages would be that every little thing will help with the overall the aim of becoming carbon neutral for the trust and having a great impact on sustainability and our planet. So this next slide, we added it in response to when we did this talk before, and we got asked about the barriers faced. And we started listing some of them because I think it's important that we discuss this because there has been some barriers. One of the biggest ones that we've faced was people were used to old habits, old ways of doing things, and it was really difficult to get them to change. So the post-it notes, it caused a post-it note war almost when we introduced it, and it probably sounds silly again, but you know, people were really like, no, that's going to take extra time. That's, you know, you can't see, you can't. But, you know, we just had to stick to it. We had to remind the team. We had to just advise them that why we're doing it, and not just letting them know from a sustainability point of view, but also a more effective and efficient way of doing things would be to write it in the note. So eventually people, you know, they came on board, they accepted it. I mean, recently I found some more post-it notes lying around. I mean, we are allowed to use them. I mean, there are going to be times that we do need to use post-it notes, but we don't want to be using them unnecessarily. You know, for taking down notes, you could be using scrap paper for that. I mean, we have plenty of that around. So although we've stopped the post-it note use quite a bit, but we still have some people that are, you know, starting to bring them out again. So we just have to continually remind. But it's also about educating the rest of the members of the team and actually talking through their concerns. So people were feeling that it's going to take extra time, it's going to take even longer, but you know, eventually everybody came on board. And when we did this talk to the actual team and we showed them the impact that they had, um, that also reiterated the message, and I think it has gone through to them now. So yeah, one of the main barriers is changing the old working habits. Like Jenna mentioned, the environment checks that we do is to check if the room's clean, the smoke alarm's working, the emergency bells are working. We used to do that on a piece of paper that was stuck to the wall. It wasn't even laminated at the time, so obviously from infection prevention, from everything, we came up with an online version, which is now easy to audit. It's there. It's all documented. No one's having to print a sheet off each, you know, at the end of each month and putting it on the wall. So again, it's made us more efficient. We're using our time more efficient, but because it was always the way that things were done, we never questioned it. So this sustainability drive can be a way of looking at old practices and making changes where needed. Some things will have to remain, but some things definitely you'll find that actually, um, even as a sustainability backdrop, we can be changing that. We could be doing that a little bit better. So I think with us, it's opened our eyes up to say, actually, what are we doing? Let's just take a step back and just look at things, our processes. I also already mentioned about the incorrect items going in the recycling bins and the clinical waste bins. So again, we removed excess ones, and we had child-friendly poster competition, which went down really well actually, and got the children on board. So again, it's about educating, it's about spreading the message, it's about letting people know the impact that all this is having. Because if we just reduce paper, people don't know what effect that's had. But when you show them like that graph that I was showing you, that informatic that I was showing you about, you know, how many parking spaces we've saved, that kind of thing, it does help people to just say, actually, what we're doing is making a difference. As I mentioned before, we had the little post-it note rebellion or resistance or whatever you want to call it. Again, it was just reiterating the message, explaining why we're doing it, and why it's making a difference. I was going to just add on to that. In our trust, like I mentioned, we have someone who's in charge of sustainability, and with her input, we've been able to do things that we possibly wouldn't been able to do just as a small individual department. Our virtual clinic for children with special educational and complex needs has won an award because it's had a massive impact on our waiting lists. But also, we conducted a survey monkey, all online, and the results of that have been all positive from parents' point of view. They really like that we're taking the time to talk to them about their child's concerns, talk to them about the child, how we can make the child more comfortable in attending. So the response to the clinics has been positive, and also from a staffing point of view, everyone's been really happy with the way the clinic's running, and the results from the patients was really good, and from the members of staff that are doing that clinic has also been positive. So You know, virtual clinics, we did it during COVID, but you know, it's the way to go for some. Of course, we need to see these children face to face too, so it doesn't get rid of that. But as I mentioned, we reduced the time slots because we don't need to spend all that time doing the case history, which can take a long time for these children. And by the time you've done the case history, the children, you could lose their cooperation. So it's been really beneficial to our department.
That's 5 minutes to the end of the so you've got 2 minutes for questions.
So yeah, so that was the last slide. So we're just going to open up to any questions, any comments that anyone may have. So Jacqueline, are you gonna? Oh, hang on, I can see.
Yes, absolutely.